I'm Dr. Gary Price. I'm a board-certified urologist. I practiced for 38 years in Fort Worth, Texas. Initially, I was in general urology practice. By the end of my practice, I was mainly specializing in sexual medicine. And in sexual medicine, I took care of a number of patients who had to be on intermittent catheterization.
I practiced urology in Fort Worth, Texas for 38 years. My practice specialized in the area of incontinence, people with bladder control problems, and pelvic floor dysfunction, mostly women who have vaginal prolapse type conditions and their complications, with people with nerve damaged bladder, most typically spinal cord injuries or stroke patients whose bladders don't function properly and don't empty properly and require some sort of intervention for management. In a typical office day, I would see about 25 patients, some new, some old. Some were there for specialized studies that we would do because of their bladder control problems. Some were there to learn to do catheterization and self-catheterization programs, which allowed them to be much more independent in their everyday lives.
Number one is to wash their hands with the Theraworx. Number two, wash the meatus with the Theraworx. Place the catheter, empty the bladder, pull the catheter out, place the Theraworx again on the meatus and again on the hands.
With Theraworx Protect, it's a simple matter of putting foam on your hands and letting it dry. Put foam on the skin around the meatus, letting it dry. Pass your catheter as you normally do. And after the bladder has drained, put foam on the meatus again and let it dry, and then move along. How common is use of intermittent catheterization? The answer is it's very common. There are many people who use a catheter and no one else knows it because it's a private thing. They don't carry a lot of equipment. They don't have bags. They don't have a urine smell. And so it allows people to approach a very normal lifestyle. Theraworx Protect is not a toxic product. It's a topical product that's non-irritating. It does not increase the risk of bacterial resistance with overuse like antibiotics can. It has been demonstrated with protocols in intensive care units with bathing beyond just the meatus to reduce the incidence of urinary infections, all based on the ICU care protocols, and it can't be used excessively with any risk of danger.
Theraworx Protect is not a prescription medication, which is one of its attributes. Because number one, it does not cause any serious side effects. There's no skin reaction. Again, it's safe. It does not form an antibiotic resistance. And you can get it either online, you can get it through your local pharmacy, through one of your home medical equipment companies. I would definitely recommend Theraworx Protect. I've used it with my family and my friends. It's worked terrifically well. There's been no side effects, and overall I've been very pleased with it. My final word to this patient is that number one, they are the most important person in their medical care, and that's why it's imperative that they learn how to catheterize properly, that they use proper technique, use good hygiene, and with that, they will dramatically reduce their chances of developing an infection or problems in the future.
Would I recommend Theraworx Protect to a patient who's on an intermittent catheterization program? Absolutely. It's inexpensive. It is non-irritating. It does not cause the development of resistant organisms or germs that are more difficult to treat in the future. And it has been demonstrated to be very effective and safe. While the concept of having to catheterize yourself may be depressing and frightening, the truth is it can be liberating. One needs to realize that this was developed after World War II as a technique that actually is safer than having an indwelling catheter and more comfortable, and allows a much freer lifestyle. It has demonstrated over a long time to cause a reduction in urinary infections, and with good hygiene programs, we think we can reduce that even further in the future.